Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a very easy yet a very important topic, which is the medical and the surgical hand washing. As we know that hand washing is a technique which is used in order to control as well as to prevent the spread of microorganisms from one person to the other. Therefore, being in this profession, as we are the ones who are responsible for providing care to each and every patient, we must make sure that we wash our hands each and every time we provide care to them. And here we should not only wash after the care is provided, but also before you provide any care to the patient, you need to make sure that you also wash your hands. In this manner, it prevents the spread of microorganisms from the patient to you, or even from the patient to you. And as a nurse, as we know that we are responsible for providing care to more than one patient. So after we have performed any procedure for one patient, if we don't wash our hands and we directly go to the next patient and provide care, then this can also transmit the microorganisms from that patient to the other patient as well. Now let's move on to the definition of hand washing. So here, hand washing is defined as a vigorous, brief rubbing together of the surfaces of the hand after it is lathered with soap, which will be followed by rinsing it under the stream of water. So here, whenever we wash our hands, we need to make sure that we first lather it with soap. After we have lathered it with soap, we need to rub the surfaces of our hands, which will then be followed by rinsing it under the stream of water. The main purpose of doing this hand washing, as I've repeatedly been saying, is in order to prevent and to control the spread of microorganisms. And also in this manner, it will also help to reduce the total microbial count over time. Garner and Favreau in 1985 recommended that nurses must always wash their hands in the following situations. That is, before they come in contact with any client who are susceptible to infection, after providing any care to the client, after touching any organic material, before performing any invasive procedures such as administration of medications, before and after handling dressings, and even after they have touched an open wound, after handling contaminated equipments or materials, and also before they come in contact with any client in the high-risk units, and after the removal of sterile and the non-sterile gloves. So according to Garner and Favreau, they have recommended that nurses must always wash their hands in the above situations. So here, the ideal duration for hand washing is not known. However, the Centers for Disease Control and Public Health sector has noted that washing time of at least 10 to 15 seconds will help to remove the transient microorganisms from the skin. So here, according to them, they have noted that at least we must wash our hands for 10 to 15 seconds, because if we do it, then this is the ideal duration of which is believed that the transient microorganism which is present in our skin will be removed. However, the more soil our hands get, the more time we must take whenever we perform this hand washing. So what are the various equipments which are required for the medical hand washing? The first one is the easy to reach sink along with a warm running water. The second is the regular soap or the antimicrobial soap. And the third is the paper towel. So these are the various equipments which must be present in order for us to be able to perform the medical hand washing. So here, before we move on to the procedure, it is very important for us to know that whenever we perform the medical hand washing, there are 7 steps that we must follow. The first one is, whenever we are performing this medical hand washing, we must rub our palms together. After we have rubbed our palms together, then we must rub the back of our hands. We must then interlace the fingers and rub the hands together. We must interlock the fingers and rub the back of the fingers for both the hands. Then after this has been done, we must start rubbing the thumb in a rotating manner, and then in this manner we should move on to each and every finger on both sides of the hands. We must then rub the fingertips on palms for both the hands, and after this has been done, then we must then rub both the palms in a rotating manner, and then we must rinse and dry our hands. So these are the 7 steps which is very important for you to do whenever you are performing the medical hand washing, and these steps must be done one by one. So now let's move on to the procedure of the medical hand washing. So here, before you perform the medical hand washing, if you are wearing a wristwatch or if you are wearing a uniform which has a long sleeve, you should make sure that you pull them up, because in this manner it will provide an access to the fingers, hands, and also the wrist. And here we must always avoid wearing rings or any ornaments, because this will increase the number of microorganisms which may be present on our hands. We must also make sure that our fingernails must be short and fine, because this is the region where most microbes on the hands will be present. So being in this profession, it is very important that we must always keep our nails short and we must file it. And then you must go and stand in front of the sink, and when you are going to perform this hand washing, you should make sure that your hands and uniform should not touch the surface of the sink, because here the sink is a contaminated area. So you should make sure that your uniform, your hands must not touch. And if your hands do touches the sink while you are washing, then you should make sure that you wash them again. You can then turn on the water, and then you can press the pedals with the use of your foot in order to regulate the temperature and the flow of the water. And you should make sure that whenever you turn on the hand operated faucet, you should cover it with the paper towel. And in this manner, because here the faucet may be contaminated, so if you touch it directly, then your hands may also be contaminated, and the microorganisms from this faucet can easily spread to your hands as well. And while washing your hands, you should make sure that you avoid splashing the water to your uniforms, because here the microorganisms travel and grow in moisture. So here, whenever you are washing your hands, you should make sure that your body is a little distant from the sink, and you should also make sure that you avoid splashing the water to your uniform. You should also regulate the flow of the water so that the temperature of the water is warm, because warm water is more comfortable to wash our hands in. When you wash your hands with hot water, then it can open up the pores and can even cause irritation. You must wet your hands and your lower arms thoroughly under the running water. And you need to make sure that when you are performing this medical hand washing, you should always keep your hands and your forearms lower than your elbows, because here your hands will be the most contaminated area. So you must make sure that the water must flow from the least contaminated area to the more contaminated area. So after you have wet your hands in with the use of the antiseptic solution, you can then wash your hands. And when you wash your hands, you need to make sure that you perform the 7 steps, which is the rubbing of palms, rubbing the back of the hands, interlacing the fingers, interlocking, rubbing the thumbs and the other fingers in a rotating manner, rubbing the fingertips on palms for both the hands, and also by rubbing the wrist in a rotating manner. And why do we use the antimicrobial soap or the antimicrobial solution? We use it because it helps to reduce the bacterial count, the bacterial count drops whenever we use the antimicrobial soap or solution. We must wash our hands using plenty of lather and friction for at least 10 to 15 seconds. And here, whenever we are rubbing our palms, whenever we are rubbing the back of our hands, or whenever we are rubbing the fingertips on the palms, we need to make sure that we do it in a circular motion at least 5 times each. And here, why do we apply friction? Why do we rub it? We do it because it helps to remove the dirt and the transient bacteria which may be present in our hands. And here the areas under the nails are often soiled, so when we are performing this hand washing, we need to make sure that we clean our nails using the nail brush or even the clean stick. So after this is done, then you can start rinsing your hands and your wrist thoroughly. But here you need to make sure that you keep your hands down and your elbows up, because if you do this, then it will rinse away the dirt and the microorganism. rinsing washes away dirt and microorganism. That is why when we are rinsing, we need to make sure that we do it thoroughly. So after you have properly washed and rinsed your hands, the next thing is you must dry your hands with the use of the paper towel. And when you are drying, since you have already performed the hand washing, you must make sure that you dry it from the cleanest area. So here the cleanest area will be your fingers. So you must dry it starting from your fingers, then to your wrist, and then to your forearm. After you have dried your hands, then you must make sure that you discard this paper towel in the proper container so that it prevents the spread of the microorganism, and then you can turn off the water. So these are the various steps that you need to follow whenever you are performing the medical hand washing. Now, when we talk about the surgical hand washing, this is just similar to what medical hand washing is. The only difference is that this hand washing will be performed before any invasive procedure is being done to the patient. And here, when you perform this medical hand washing, as I've told you that you will only be starting from the wrist, right? But when we talk about the surgical hand washing, we will be washing our hands up to the elbows. So this is about the medical and the surgical hand washing. I hope you have got a clear understanding of this topic, and you need to make sure that whenever you are performing this procedure, you should never miss any of these 7 steps. I'll be meeting you in another session. Until then, have a good day. Thank you.